Hi, my name is Alana Carrasco, and I am currently a third-year medical student. Today, I will be presenting our research titled Local Disease Burdens and Prescription Rates in 4 Indigenous Communities of Rural Guatemala. This research was conducted through our Global Health Department in partnership with Refuge International, which is a non-governmental health organization that has provided surgical and medical care in different rural communities of Guatemala since 2003, with the majority of people in these communities being of Indigenous background and lacking accessibility to healthcare. In addition to typical acute illnesses, rates of chronic non-communicable diseases are rising, and this poses major public health issues, but there is still insufficient data on the prevalence of these diseases in these communities. Our goal of this study was to characterize local disease burdens, both acute and chronic, as well as the nature of medications that are prescribed in 4 rural areas in order to provide a basis of epidemiological data for future tracking and monitoring of these populations. This was a retrospective chart review of patients seen in these sites from March 2019 to February of 2020. Overall, 1,094 charts were included. 774 of these were female, 320 were male, and 29% were children. Overall, the top 3 most common diagnoses in order were gastrointestinal, dermatologic, and obstetrical and gynecological in nature, which are divided here by clinic site. The 3 most common medications prescribed were NSAIDs, GI medications, and antibiotics, and again, these are broken down by clinic site. We also characterized the rates of diabetes, hypertension, and obesity. The rates of diabetes and hypertension were calculated from prior diagnoses as well as diagnoses that were assigned on presentation per the patient's chart. Overall, 11.3% of adults had diabetes, and an overwhelming 79.3% of those were female. 33% of the adult population had hypertension, and again, a majority of these were female. In our total adult population, 83.5% were found to be overweight and 40.8% were obese, with both rates again higher in female. We believe that understanding the epidemiology of diseases in these different communities is imperative to providing more effective medical care and interventions, especially with the health disparities that are present. We believe that healthcare providers should be prepared to encounter mainly GI, musculoskeletal, dermatologic, and obstetrical and gynecological conditions, in addition to diabetes, hypertension, and obesity. We believe that the clinics can be best prepared by keeping stock of NSAIDs, albendazole, vitamins, and GI medications. And we would encourage clinic providers to provide diet and lifestyle counseling in order to help curb the prevalence of these lifestyle diseases as well as their potential complications. In conclusion, I would like to thank Refuge International, as well as UT Southwestern's Office of Global Health for their support and for helping make this research possible. I hope that you enjoyed this presentation and found it to be interesting. Please feel free to ask questions. Thank you for listening and have a wonderful day.